When taking omega-3, be sure to follow the directions on the package label. If you have any questions, it's best to consult your doctor or pharmacist. If you're using enteric-coated capsules, swallow them whole. For the chewable form, make sure to chew thoroughly before swallowing. If you're using the liquid form, be sure to measure the dose carefully using a special measuring device/spoon. Avoid using a household spoon as it may not give you the correct dose. Some brands of this medication need to be shaken well before each use. If your condition doesn't improve or gets worse, or if you think you have a serious medical problem, seek medical help immediately. Some common side effects of omega-3 include a fishy aftertaste, if your product is made from fish oil, nausea, bloating, or burping. If any of these effects persist or worsen, it's important to consult with your doctor or pharmacist. If your doctor has recommended omega-3 for you, it's because they have determined that the benefits outweigh the potential side effects. Many people using this medication do not experience serious side effects. However, it's important to seek medical attention if you experience any serious side effects, such as easy bleeding or bruising. In rare cases, a serious allergic reaction may occur. If you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing, seek immediate medical help. This is not a complete list of possible side effects, so it's important to consult with your doctor or pharmacist if you notice any other effects not listed. If you're in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. If you have allergies to omega-3 fatty acids or fish, or any other allergies, make sure to talk to your doctor or pharmacist before using this medication. This product may also contain inactive ingredients that could cause allergic reactions or other problems, so it's important to discuss this with your pharmacist for more details. If you are pregnant, it's important to only use omega-3 if it's clearly needed. Be sure to discuss the risks and benefits with your doctor before taking it. It's not known if omega-3 passes into breast milk, so consult your doctor before using it while breastfeeding. When it comes to omega-3, it's important to consider possible interactions with other medications you may be taking. It's always best to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your healthcare provider. This will help them determine if there are any potential interactions that could affect how your medications work or increase your risk for serious side effects. Always consult with your doctor before starting, stopping, or changing the dosage of any medicines. If you or someone else has taken too much omega-3 and are experiencing severe symptoms like fainting or difficulty breathing, call 911 immediately. Otherwise, contact a poison control center right away. In the US, you can reach your local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center for assistance. So, when it comes to omega-3, it's important to note that there are potential benefits for your health. Omega-3 fatty acids are known to help lower the risk of heart disease, reduce inflammation, and improve brain function. It's recommended to take omega-3 supplements with a meal to help with absorption. The daily recommended dosage can vary depending on the individual's needs, so it's best to consult with your doctor to determine the right amount for you. And make sure to keep up with any medical appointments or lab tests while taking omega-3 to monitor its effects on your health. So, what about the usage of omega-3? If you happen to miss a dose, take it as soon as you remember. However, if it's almost time for your next dose, just skip the missed one and take the next one as scheduled. Avoid taking a double dose to make up for the missed one. It's important to stick to your regular dosing schedule. As for the optimal timing, it's best to take omega-3 as directed by your healthcare provider. Make sure to check the storage information on the package and ask your pharmacist if you have any questions. Omega-3 should be protected from light and moisture, so avoid storing it in the bathroom and do not freeze it. Keep all medications out of reach of children and pets. When it comes to disposing of omega-3, do not flush it down the toilet or pour it into a drain unless instructed. Properly discard the product when it is expired or no longer needed, and consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.